Hi everyone. We can discuss the part B of staff nurse exam RRB. 51st question. Moon face with central obesity is noticed in Addison's disease, Cushing disease, Down syndrome, Turner syndrome. Answer B. Kerning sign is a striking feature of meningitis, nephritis, neuritis, dendritis. Answer A. Meningitis. Next question. Colles fracture refers to the injury of shoulder joint, knee joint, wrist joint, elbow joint. Answer C. Wrist joint. The lack of oxygen supply to myocardium leads to fibrillation, heart failure, angina, infection. Here the answer is heart failure. Any disturbance that blocks the transmission of nerve impulse from SA node to downwards is known as heart block, heart attack, nerve block, cardiac arrhythmias. Answer A. Heart block. The erosion of mucosal layer of stomach muscle is termed as duodenal ulcer, gastric ulcer, Crohn's disease, diverticulitis. Here the answer B. Gastric ulcer. The inflammation and degeneration of liver parenchyma is cirrhosis, jaundice, colitis, cystitis. Answer A. 58th question. Shostak's sign is an indication of hypernatremia, hypercalcemia, hyponatremia, hypocalcemia. Answer D. Hypocalcemia. Hyperkalemia leads to what changes in ECG? Inverted T waves, tall T waves, prolonged QT interval, wide QRS complex. Answer B. Tall T waves. The amount of protein intake to be maintained during renal failure 40 to 60 gram per day, 60 to 80, 20 to 40, 80 to 100. Answer A. The enzyme level which found elevated after myocardial infarction, serum creatine, alkaline phosphate, phosphokinase, creatine kinase. Answer D. Creatine kinase. The position to be maintained for a patient with increased ICP: Fowler's position, Trendelenburg position, sideline position, supine position. Answer A. Fowler's position. Warfarin acts as an anticoagulant by blocking the synthesis of RBCs, vitamin K, vitamin E, hemoglobin. Answer B. Vitamin K. The fetal movement felt by the mother during 20th week. Lightning, quickening, crowning, labor pain. Answer B. Quickening. Violet coloration of the mucous membrane of cervix and vagina at fourth week of pregnancy is termed as Chadwick sign, Haga sign, Goodell sign, Rousing sign. Answer A. Chadwick sign. Blood and debris discharge from the uterus after delivery is termed as septic shock, lochia, pyuria, hematuria. Answer B. Lochia. Occurrence of seizures during pregnancy is termed as eclampsia, preeclampsia, epilepticus, myoclonus. Answer A. Eclampsia. The realignment of fetal head with the body after the head comes out. Expulsion, dissent, engagement, restitution. Answer D. Professional negligence is legally termed as crime, assault, malpractice, slander. Answer C. Malpractice. Premature separation of placenta from the uterine wall before delivery is abruptio placenta, placenta previa, fetal distress, cord prolapse. Answer A. Abruptio placenta. The failure of uterus to return to its normal sizes, involution, subinvolution, protrusion, retraction. Answer B. Subinvolution. Next question. If a newborn's head and trunk is allowed to fall backward, it elicits stepping reflex, plantar reflex, stepping reflex, Moro reflex. Answer D. Moro reflex. A newborn who is above 19th percentile on intrauterine growth curve is termed as postterm baby, large for gestational age, small for gestational age, preterm baby. Answer B. Crawling of an infant occurs at 8 to 9 months, 2 to 3 months, 4 to 5 months, 6 to 8 months. Answer A. The preferred site for giving IM injection to infants is gluteal, deltoid, vastus lateralis, umbilicus. Answer C. The main drug of choice for heart failure is decadrone, digoxin, morphine, F-choline. Answer B. Digoxin. The procedure, which involves giving a synchronized countershock to convert the undesirable rhythm to stable rhythm, is defibrillation, cardiac stimulator, pacemaker, cardioversion. Answer D. In chronic renal failure, all the following noticed except anemia, hypocalcemia, metabolic acidosis, hyperkalemia. Answer D. Hyperkalemia. Identify the calcium channel blocker from the following: nifedipine, atenolol, Lasix, mannitol. Answer A. Ego works based on reality, pleasure, perfection, conscious. Answer A. Reality. Gradual disappearance of conditioned response to stimuli is referred as negative conditioning, extinction, delayed conditioning, elimination. Answer B. A defense mechanism that allows to convert our unacceptable behavior into acceptable form, introjection, sublimation, projection, displacement. Answer B. Father of intelligence test is Alfred Binet, Erik Erikson, Alfred Adler, Carl Jung. Answer A. The stage which keeps an individual physically alert to face the danger arising out of stress is termed as adjustment reaction, stage of resistance, exhaustion stage, alarm reaction. Answer D. Elevated mood with psychomotor activity is a characteristic feature of mania, euphoria, bipolar disorder, dysthymia. Mania. Irrational fear related to closed spaces is referred as acrophobia, agoraphobia, claustrophobia, nosophobia. Here the answer is C. Loss of personal identity and wandering away from the psychiatric hospital is referred as fuse, split personality, possession state, trance state. The voltage needed to produce issues while giving ECT is 180 to 220 volts, 40 to 70, 150 to 180, 70 to 150. Answer D. The emotional state an individual experience to the loss of loved one, grief, mourning, bereavement, agony. Grief. Release of feelings that takes place by talking about an emotionally areas. Clarification, abreaction, suggestion, exploration. Answer B. Abreaction. Temporary discharge of the patient from the psychiatric hospital is referred as parole, abscond, termination, escape. Answer A. Parole. The drug which is used to create aversion in alcohol dependence: apomorphine, propranolol, diazepam, disulfiram. Answer D. Disulfiram. Serine is an example of antipsychotics, antidepressant, mood stabilizer, anxiolytics. Answer A. The recording of conversation between the nurse and patient in a psychiatric setup. Therapeutic communication, interview technique, process recording, case study. Answer C. The function of gland which is affected in lithium toxicity. Parathyroid, pituitary, adrenal, thyroid. Answer D. Thyroid. A behavioral therapy of sudden, direct, and maximum exposure to the fear producing stimulus. Biofeedback, flooding, desensitization, response prevention. Answer B. The metal which is commonly used for family planning is copper, aluminium, iron, silver. Answer copper. One PHC covers a population of 50,000, 30,000, 10,000, 1 lakh. Answer B, 30,000. The multipurpose worker in general serves a rural population of less than 500, 1,000, 3,000, 5,000. Answer D. The system of storing and transporting vaccine is termed as cold chain, cool chain, freezer chain vaccination. Answer A. Cold chain. Thank you for your patient listening.